So Morgan, that's the minutes are the only thing we need to vote on. I doubt we're gonna get quorum. Can we just like defer next time?
We'll just have to defer.
Sure.
Yeah.
Okay.
Is everybody at the other meeting pretty much?
It's on this side.
Definitely a bunch of people are.
Okay.
Okay.
Yeah.
Thank you.
Thank you so much. I was like, where is it?
Oh, yay, more people.
Get started in just a few minutes. We'll just give a few more people a few minutes to join.
And while we wait, I did make a couple of adjustments to the agenda. Just include the minutes, which we might not be able to vote on anyway. And then Brady, you're going to give an update on the U equals U. And I had you talking about the nomination form later on, but you can just put that in with the U equals U update. Is that good? And I have it pulled up so I can share it so folks can see.
Awesome, thank you.
Looks like we've got quorum now.
Yeah, I think we do. So we'll go ahead and get started. Good afternoon, everybody. Thanks for joining us for our HIV Epidemic Advisory Council meeting for April 7th. I know a lot of people are out today. I think we have a fairly quick agenda. I am Deanne Bullock. I'm at Nashville General. I am the co-chair of the Advisory Council, and I think everybody knows Claire Bowles. She's my co-chair, so let's raise your hand, Claire, for anybody that may not know you. And then Morgan is on with us. Morgan, you have hit record, correct? Okay. Do we have enough for quorum? Yes. Okay. So the first thing that we have to do is just approval of our minutes from the February 3rd meeting. These were sent out for review. If everybody has had time to review them, we'll take this opportunity to add any amendments or changes. If there are none, I'll just need a motion for approval.
Motion to approve.
Second.
And a second. And all in favor? All right. Thank you. All right. Next, we're just going to go through a few updates that we have from the EHE work groups, really about just our development in Nashville's involvement in the fast track cities, and then a couple items of new business, the development of an EHE website for Nashville, some advisory council nominations, and then newsletter submissions. So I'm going to kick it over to Morgan, and she's going to start with the update, or she'll handle through the updates And our first one is with Brady Morris.
Yeah, Brady, so if you just give us an update on the U equals U task force, that'd be
Sure,
great.
absolutely. Just let everyone know, the U equals U task force has been moving forward strongly. We have secured a photographer. Her name is Emily Allen. She is a local uh, photographer who navigates through lots of different communities within Nashville. She was very excited to be asked to do this. And I'm excited for her to do this as well, because she was very receptive to being able to work within our budget that we had, even with us wanting to go to multiple locations to shoot. And I think with her already having an established kind of presence within the community, we can get a further impact and reach more people when she starts sharing the photos as well. So really excited about that. We have completed our nomination form. Um, that will be going live soon. The only other aspect that we have to do that, thank you, Morgan. Here's our nomination form. We were very cognizant of the words that we chose, how we asked questions. We didn't want to like particularly put anyone in a box, and we used verbiage to allow people to identify how they feel comfortable identifying. So that we know with our own metrics, how what parts of the communities we're going to be able to hit. So I'm very excited for this nomination form. It will go live as soon as we just have a couple of more details to nail down for the memorandum of understanding, or the MOUs. Basically, what we expect from the ambassadors that are chosen, what we expect from them, because as you all do know, we are going to be paying these ambassadors on a quarterly basis for their work, which I think is extremely important. And I think that's it with the U equals U task force, but we are looking to hopefully start shooting and get our photos done this spring, just as soon as the weather warms up or becomes a little bit more stable. That's funny to even say in Tennessee. I don't know if we ever have stable weather here, but once we know that it's going to be nice out, we'll get those photos taken, and then it'll just be a matter of getting messaging and graphics, and then we'll be able to go live hopefully by either end of summer or early fall. That's what we're targeting.
Uh, Thank you, Brady. And I will be sending the nomination form, the link to everyone. If you could help us with recruitment, so that's a big next step. We do need folks, we need ambassadors to be a part of this project, people who are living with HIV, and we want that to be a very diverse group. And so if you could share it within your networks, if anyone might be interested, or someone who might know someone who would be interested in being an ambassador, that would be very helpful. So I'll be sending you all that, as well as the MOU, so you can spread it and share it. So the next group is the prevention work group. So that group recently finished working on a project, a resource for folks who are underinsured or don't have any insurance, to help them access PrEP for free or at a very low cost. So the resource has been created. It lives online right now. And now the group is working on a distribution plan. And so we're trying to decide how we want to distribute the resource and which populations we want to target and how we want to target them. We're looking at, whether we want to house it on like different websites, or print brochures, or make like palm cards or coasters or things like that. And I've been talking to Meredith at TDH, because they have some HIV prevention funding that we could use to help with distribution. So we're trying to figure that out now. We thought the hardest part would be creating the resource, but it turns out the hardest part is making sure it gets to the people who actually need it, and who will use it. So that's what's going on with the prevention group. And then the equity work group had their first meeting for the year last month on the 8th. And basically they talked about, or the main things come out of that meeting were like the priorities that they have. They really want to see the larger EHE group reconvene. And so I shared with them that the council had been talking about having, you know, that EHE conference at some point, like in late summer. So that might be an opportunity. And they just really want to know what the other work groups are working on and what projects they're doing, because they see themselves as a resource to making sure those projects are done like equitably. And so they want to make sure that the other work groups know how to use the equity lens that they've worked on. They also are looking at grant opportunities. Apparently there's some COVID-19 funds available through TDH, and they also have the potential for trauma-informed care funding to help move their equity agenda forward. And they established, or I don't know if they established it, but a Tennessee Community Health Worker Association has been established. And they're looking at how they can integrate like the equity lens into the training of those community health workers, which is pretty exciting. So that's for the equity work group. Claire, did the trauma-informed group have anything to add?
Yes, we're making good progress. Lauren Brown and some of her associates at Meharry have been hard at work on doing key informant interviews with the participating sites in the Trauma-Informed Care Project, and using that information to create process maps for these sites. Last I heard at our last meeting, which was just a couple of weeks ago, 4 out of the 5 participating sites had contributed a good number of key informant interviews, and she was working on getting that 5th site to provide some contacts for interviews. I think the grant that is funding her time on that project is wrapping up at the end of this month, so hopefully we will get a couple more interviews before that time. But yeah, they're making really great progress on that.
Awesome, thank you. And then I think the last update is about fast track cities. So if you remember at our last meeting, we had someone from, it's a long name, the International Association of Providers of AIDS Care, IPAC, present to us about Nashville becoming a part of the Fast Track Cities network. And that's something that the council had previously approved, and we approved it again in February. And so I've met with Dash, who is representative, a couple times in the past week, and Brandon also joined the last meeting. And so does anyone have any questions at this point about what Fast Track is, or what the benefits of Nashville being a fast track city would be? Or, okay. So the next step is to have a signing ceremony where the mayor can sign the Paris Declaration, and with that signing, Nashville would become a part of the network, and then we'll have access to all the resources within the network, and then IPAC has funds to create a dashboard for Nashville that can help us track. Well, the metrics are kind of up to us and different stakeholders. And so in our last meeting, we identified June 3rd as a possible date for the ceremony, because June 5th is, I think it's, do you remember, Brandon, Long-Term Survivors Day or something? Is that it, Dr. Bullock?
Cancer Survivors, National Cancer Survivors Day.
Yeah, that's what it is.
Oh,
HIV Long-Term Survivors Awareness Day is June 5th.
okay, so that as well. And that's a Sunday, so probably no one wants to do a ceremony on a Sunday. So Friday, there is an option to have the ceremony or the following Monday. And also our next council meeting is the Thursday before that. So the ceremony would just be 45 minutes to an hour. The mayor will sign and give some remarks, and the hope is to have, you know, as many council members there and also representatives from your organizations or members of your organizations there, as well as really anyone in Nashville who would be considered a stakeholder in the EHE work. And then after that, there would be an implementation workshop that's about 3 hours. It doesn't have to be on the same day as the ceremony. It can happen before or after, but we would talk about how we would, you know, implement or what it would look like for Nashville practically to be a part of the Fast Track Cities network and how we want things to progress. So my question to you all, well, I have several, and one would be, and I'll send this in a recap email too, but we do need to know who are the key people to invite to the signing ceremony, to participate in the signing ceremony, and also voices that need to be included when we talk about building the dashboard and knowing which metrics we want to be measured as part of the dashboard. And also, more immediately, does June 3rd or June 6th feel like enough time to tell folks about the ceremony, about Fast Track Cities, and to get stakeholders involved and wanting to participate in the whole thing?
Morgan, is this going to be a live ceremony or okay?
So yeah, it's going to be, do you mean in person live or? Yeah, so
Yeah, sorry.
yes, so you can also stream it. So there's an option for folks to it will be happening live, but there's an option for people to tune in online or virtually via streaming. Did you have a chance, Brandon, to see?
I haven't asked the mayor yet, or his scheduler. I just wanted to make sure that June 3rd actually worked for you all first. But I think it's far in advance that I can just say, hey, look, I would love for the mayor to participate in this event and just explain it to him briefly. So as of right now, I don't have a schedule conflict for June 3rd. But I think the majority of whoever you all have involved, and if that works for you, it should work on our end.
So Brady, you're nodding. You're available June 3rd to attend the ceremony. Yeah. We really, so I'll be, I don't know if honest is the right word, but I will definitely need like the council to help publicize the event and also get other folks on board to participate, because I know the HIV prevention and care network in Nashville is varied and large, and we just want everyone involved and represented, and we don't want anyone to feel like they've been purposefully like left out. So
I do have a question. Is
yeah.
it appropriate if I ask a question right now?
Yes, I think so.
Okay. Would this be the press conference? Would it be held at the health department? A location?
That's a good question. Yes, I'm gonna say yes. Or what were you thinking, Brandon? Like the mayor's office?
No, I would rather
Okay.
something like this. For something like this, I'd rather him come to you all.
Okay. So yes, I'm gonna say yes then, and
Okay.
also
We can
I
always
don't have
talk
authority,
offline.
so I will check with the higher ups, but that's I can't believe we didn't talk about that part. Yeah.
Okay. That's all. Thank you.
Okay. Does
Morgan?
anyone? Yes.
Can you tell me the time again so I can?
So we don't have a time set yet, but it would be June 3rd during the, I'm going to say morning or early afternoon. Is there a time that works better
Well,
for you on that day?
Fridays are unfortunately really busy for me, but if I had a time, I could go ahead and give it to Kimberly.
Okay.
She could lock it in. So as soon as
Okay.
you have that level of detail, could you share it, please?
Absolutely.
Thank you.
Any other thoughts or questions? If not, we can move on. But I will be sending you probably a good amount of information and also requests regarding the fast tracks thing, event over the next couple weeks. So.
All right, so we'll move on to some new business. We had a conversation, Dr. Bullock, Morgan, and I, with Amber Coyne, who is leading the statewide in the Syndemic Initiative. And they have a website that is, considering it's a state-run project, the website really doesn't have any state branding on it. And the ETS group basically has free reign over the content and design of the website. So we had a conversation with them about allowing us to, and I'm going to drop the link to the, yeah, I'm going to drop the link to the website in the chat if you all want to check it out, if you haven't taken a look at it yet. One thing we've been talking about for years and haven't really been able to get off the ground is a need for a website and sort of an online presence. And that could be a way for us to have a little more transparency about what is going on in EHE and across the work groups that are, as we just heard, working on a lot of really cool things, and a way for people to get more involved and reach out to leadership and in EHE. So we met with Amber to discuss the possibility of using part of the website for some of our updates. ETS is going to be building out portions of their website for the different public health regions across the state. And so our content would likely be housed as part of the Mid-Cumberland region, which isn't a perfect fit because it encompasses some other counties outside of Davidson, and EHE is just focused on Metro Nashville. But this would be a free option and would require a lot less work on our end since the website's already been built. And like I said, there's surprisingly little red tape. So we wanted to just discuss a little bit about what we might share on a website and whether we think this is the right venue or whether we need to develop our own space. And one thing that didn't occur to me until just now, Morgan, maybe you can refresh my memory on this, but I know that the Fast Track Cities dashboard, which will have a lot of our data, there are some options for sharing things there as well, but I can't remember exactly what that looked like or whether that would be a better option for any reason. Do you remember?
It would not be a better option, I would say. We could link the dashboard to whatever EHE website we end up having, but I don't think using the Fast Tracks website would encompass all the things we want to communicate to folks about EHE.
Okay, that makes sense. So some of the things, I guess maybe first, I'll open it up for discussion. What do people think about this plan? Is this the right space for us to share EHE updates, or should we have something that's more our own?
I was wondering if we do go the route of using the website that the state health department already has, would there be a way, like in the future, if we were to get funding or something, to be able to move that out? I mean, like use it for now since it is free and there's not any red tape to build our site. But then in the future, if we have the funds to be able to pull that out and move it to stand alone in the future, if possible.
Great question. I think so. I think Amber's kind of doing us the favor here by letting us have some space on their site that they funded and spent a lot of effort building out. So I don't think they would have any problem with us starting our own website if at some point we were able to do that.
Because I don't think it would be an issue because like nowadays, most of the way we find our information or websites is through Google, and no one really pays much attention to, to what that web address is. But if someone just were to Google, ending the HIV epidemic, Nashville, it would still take them to that site. So I don't see a big issue with it being housed under that. But I'm curious to see what everyone else has to say.
And if nobody else really cares too much, I think this is probably the easiest thing for us to do. We've been talking about it for years and haven't been able to get anything off the ground. I don't know how to build a website, so this seems like the best option. And like Brady said, at some point, if we want to create our own, if it doesn't work out, we can always, if we feel like people aren't seeing the content, then we can always start working on building something of our own. So next, I wanted to talk about what we should be sharing on the website, what sort of content we want to provide. I think there's a few obvious things. Of course, we would want a copy of the EHE plan to be housed there, list of advisory council members and our meeting minutes, contact information for the work group chairs for people to contact if they'd like to get involved with the work group, and a space for those work group chairs to provide updates on their projects and other sorts of opportunities to get involved. Is there anything else people can think of that would be helpful to include?
I think just off the top of my head, when we get the Fast Track City, we would definitely want to link to that. Also possibly a link to the permission access campaigns website for any information on U equals U, since PEPFAR and CDC Global also recognize PAC as like the predominant place to go get information on U equals U. I think it would be important to include that. And then also information about our local HIV services, our links to our local ASOs, and the resources there. I'll keep thinking though.
So that's a great point. I hadn't really thought about including resources. What other resources do we think would be helpful there?
Because I'm thinking, like free testing, being able to access that. but definitely like including, you know, contacts to first response, Meharry Wellness, Nashville Cares, My House, Streetworks, maybe even neighborhood health, Magruder.
Are there any other resources that aren't necessarily specifically HIV, but I don't know, things like housing? I know that our social workers use Where to Turn in Nashville a lot. Maybe we could link out to their, I think they have a website. I know they have printed materials, but
So Claire, I agree with that. I mean, rather than access to care, there are a lot of other needs that some of the patients have. So if we can link them to those services, that would be great. Just in terms of the social determinants of why people find themselves in those places. So I agree with that idea that we have to have links to other services that would be helpful to folks. Free testing is good and access to care, but maybe there are other things like transportation and housing and all those things. So
speaking of transportation, and I think we may actually be missing a presentation at the statewide meeting about this right now. But just curious, and sorry if this is off topic, but does anyone on this call know more details about the rideshare options that Metro is, I think, going to be providing for appointments?
I just know it's going through Ryan White Part A, but I don't know. I haven't heard anything lately as to like who they're doing it through or how to access. But like Dr. Hilde just said, something like, you know, a link to those services, yeah, especially food too. I know there's lots of food deserts, and people need assistance with food. Utility payments and we could even like reach out or ask our ASOs, what services, you know, do you provide that many people aren't, or like that people aren't accessing enough or whatnot, that they need help promoting and getting the word out that exists.
Yeah, our biggest needs have been things that we can't supply, include things like housing, rent, utilities. You know, we're held to federal law restrictions, kickback laws about what we can spend money on and how much we can spend money on per patient. We generally limit about $15 per encounter per patient, or up to $75 per year. Transportation and nutrition are generally excluded. So we can fund really transportation anywhere. I think COVID has lifted the 25-mile restriction. And then nutrition, I think our legal team is just kind of turning a blind eye to. But yeah, anything beyond that, housing, utilities, we cannot cover. We can't cover cell phones, which we'd love to. And we're working on a legal agreement right now called a value-based arrangement to provide dental care, which is going to be, you know, a huge expense, way beyond the federal limitations. But it's a huge legal process to be able to get that done. So yeah, utilities, housing, dental are huge needs for our clients. You know, in addition to, you know, transportation and nutrition, which is easier for us to provide.
So I'm trying to figure out who the audience is for the resources. Do we want people to go directly to these various service providers, whether housing or transportation, or do we want them to go through some kind of case management where we can actually follow up and make sure that they're hitting all of the dots, that we're connecting the dots for them? I mean, I would think we would say something like, you know, if you don't have a case manager, I'm assuming we're talking about people who are living with HIV? Is that sounds like the audience we're discussing, right? If you don't have a case manager, here's how you get one. And these are all the things that a case manager can do for you, as opposed to direct links to each of these things. I mean, you know, if I didn't know that a case manager is available, it'd be kind of daunting that I'm supposed to click on each one of these things for housing and transportation and food and dental and mental health. And, you know, just a thought.
No, I think that's a great point.
Yeah, Rich. Yeah, I don't think and I don't even believe like even CARES or StreetWorks, their websites have just individual links to these different services. But like you said, they would have to be provided through case management. But just and the way I see it is just at least listing that these services are available. You know, or like what services are available at each ASO. But then also too, definitely Music City Prep Clinic would also need to be listed there as well.
Yeah, without case management, I think food and maybe syringe service might be the two I can think of that a patient could just access as needed without case management. But yeah, everything else, even transportation, you know, should and probably has to be set up by a case manager.
Correct. Yeah.
So I think what I'm hearing is maybe that instead of having direct information about a lot of these sort of ancillary services, we should instead be including contact information for appropriate people at various organizations that people could contact for assistance. My only concern about that is we'll have to make sure that that information stays updated. And I mean, that goes for everything that we post publicly, but you know, with contact information that can be especially tricky. But is that kind of where we're heading with this?
Could it not be both? Because that almost sounds like gatekeeping information, like telling someone you have to do this, and feels disempowering in a way. Even if it's true that they can't access those services without a case manager, just knowing those things exist feels like it could be empowering to someone and they can know what to ask for.
Okay, yeah, that makes
Yeah.
sense.
Because I know, like, you know, I was a client, you know, at CARES for, you know, several years before I even actually knew that, you know, I could get rent assistance or utility assistance. So just somewhere where that's available for someone to be able to see on their own independently and read, to know that those services even exist, like Morgan said, could be more empowering and hopefully draw some of these people out to actually access and utilize these services that exist instead of sitting at home, isolating, alone, suffering. So.
I do think by listing them all out, you give people the opportunity to ask about certain things because, like you said, Brady, they may not even know they exist. They may not even know to ask. And I also feel like just having somebody ask specifically for a case manager, some people aren't comfortable doing that. And I think we also need to make sure that we guide it appropriately so that maybe it's a family of somebody, a family of a patient or a friend of a patient that can navigate it as well. It may not necessarily be the patient themselves.
I love this idea too, because I think if we're including not only resources, but contacts for different organizations and putting all the resources out that all of our amazing organizations have to offer, it's really sort of in the spirit of this whole initiative, which is kind of all of us working together to make sure that people living with HIV in Nashville are being served the best way possible. So I was just about to suggest something else we could include, and it's slipped my mind. Anyone else have resources they think should be included here?
The only other thing, Claire, and I think maybe Rich mentioned it, and it was kind of at the top of my list, is always making sure they have the mental health resources as well. Counseling and the access to the counseling and providing that resource for them.
And I remembered what I was going to say. I'm almost embarrassed to say it because I'm like the education person, but I am used to providing education for healthcare providers, and I think that this website is probably going to cater more towards community. I wonder if there are some really good either videos or easy to read HIV basics kind of resources that we should include too. Maybe that can be my homework. And one other thing I wanted to know, we have touched on this before, but just wanted to kind of bring it back. I think, I don't know if Morgan, if you've been here when we've discussed this in the past, but we have talked about, you know, before COVID, these meetings were held publicly and people could come and attend and just observe. And we discussed doing that with the online format. And I think it's probably time to revisit that conversation and think about making these public again. And that's another thing that we could include on the website is information about when the next meeting is and how to join.
I don't know if you all are familiar with so there is an EHE page as part of the MPHD website that does have information about like when the meetings are and a link to join the meetings. I highly doubt anyone ever accesses that page, but it's there. So just FYI. But yeah, that can be on the EHE website when it's established.
So you're saying nobody wants to come and watch these meetings? All right. In that case, does anybody else have anything else they wanted to add for the website? And do take a look at the ETS website if you haven't had a chance to yet. So we're going to move on to discussing advisory council nominations. And during our last meeting, we talked about the importance of having more people living with HIV represented on the council. And according to our bylaws, the council can have up to 25 members, and we're still well below that number. So nominations can happen on a rolling basis, and we do have an ongoing opportunity to identify and nominate people living with HIV, as well as members from other demographic groups that currently have low representation for council membership. So as a reminder, Morgan's sharing our demographic goals of the council, which include radical inclusion, and I'll just let everybody read this for a moment.
Sorry, I couldn't figure out how to unmute myself to ask like where you wanted me to scroll to. There's the demographics list, but there's also like a blurb about the radical inclusion premise.
I think everyone knows the radical inclusion, well, maybe not. So basically that first sentence, radical inclusion is defined as an active, intentional process to welcome, involve, empower, and engage individuals in our work who would not otherwise find their way into the conversation. I think that we can probably scroll down now to the demographics.
So
And I think in general, right now, we just have a kind of a small council, and unfortunately, today is not a great representation because we do have some other meetings going on today. So a lot of people weren't able to make it, but we are going to send out the nomination form after this meeting, along with a copy of the recruitment guidelines. So please take some time to identify and nominate individuals that you think are going to be a good fit for the council. We will review and vote on nominations during our June 2nd meeting. So I encourage you all to nominate at least one person. I'm going to try and nominate 2. So please keep an eye out for that. Morgan, I will kick it back to you.
sure. So the last thing, so I'm responsible for producing a monthly EHE newsletter that you might have noticed has not happened yet, but April is the month. So it can include anything EHE related. Right now, I'm going to have it just include updates from the work groups, information about the projects that they're working on, definitely stuff about fast track cities, some information about the council. But if at any point you have an event or information or just a topic that you think needs to be highlighted and publicized to like the EHE community, just shoot me an email and I will make sure that gets included in the newsletter. But look out for that first one coming this month. Yeah, and that's all I have for that.
Thanks, Morgan. Thanks, Claire. I think we are at the bottom of our agenda for the day, kind of a little bit of a short agenda. Does anybody have anything that we need to discuss in a roundtable or any announcements before we go?
I have an announcement. The construction of our new building in East Nashville will be wrapping up in May, June, finally, after 2 years. And that will enable us to proceed with PrEP services there, HIV care, also very exciting LGBTQ primary care. There'll be an LGBTQ community center there, and Canvas, the bar on Church Street, will also have a location there. And then in a surprise twist, we went ahead and bought a second building already. And we should be able to close on that in May. But we are in a fast track, to use the word fast track, process to get services up and running there by the end of April. And the location is really very exciting. It straddles the Meharry, Fisk, Tennessee State neighborhoods, as well as the center of the hospital district. We're across the street from HCA, just a couple blocks away from Metro Health, VUMC, St. Thomas. So that's at 28th and Charlotte.
That's awesome. Congratulations, Rich.
Thanks.
Congratulations. Any additional announcements? All right. Our next meeting is going to be Thursday, June 2nd, from 2 to 3:30, same place, same time. Obviously, we'll have definitely some emails and communications going out in between time from Morgan to keep us updated on the announcement, the signing, as well as a couple of additional items. And keep a lookout for those emails. Likewise, myself, Claire, and Morgan are always available. Always willing to receive emails, suggestions, or comments to make everything better for all of us. So if nobody has anything else, we will adjourn the meeting for today. I'll thank everybody for their time today, and I hope you guys have a great afternoon.
Thanks, everyone.
Thanks. Have a good one.